Hello everyone, I am Chetna Belgere from South First. With me today in conversation is Dr. Rajeev Jayadevan, Co-Chairman, National IMA Covid Task Force member, Public Health Advisory Panel. He was also the member for Public Health Advisory Panel, Kerala State IMA. Today he is with us to clarify some very basic queries from the public on the COVID-19 JN1 in particular. Doctor, welcome to the show.
Thank you.
Sir, you are in the state of Kerala, which has been reporting the maximum number of COVID-19 cases, which means Kerala is doing a tremendous job of testing well. And considering this, what is the current status of COVID-19 in India in particular?
We know that COVID-19 is a cyclical disease, which means that there will be a wave of cases. We call them waves or surges, whatever you want. But there's an increased number of cases which will last, say, 2 or 3 months. And then it will settle down on its own. And then there will be a relatively case-free period of several months. In this case, it was 7 months. So at the end of 7 months, we are seeing a surge in cases again. So you asked about the situation in India. I'll give you numbers. I believe in numbers, because if we do not have actual numbers, then speech doesn't make any sense. So if we look at the numbers that we have, because we network with a lot of doctors in the region who work in multiple different settings, like government medical colleges, private clinics, large referral centers, family doctors, etc. So from across the board, I'll tell you the picture. There has been an increase in respiratory infections over the past few months. Most of that was influenza, most of that. But remember, when a doctor sees patients in India with a cough and a cold, it's very unlikely that the doctor will ask the patient to go for expensive tests to look for exactly what virus is causing the disease, because in many instances, it may not necessarily change management, with the exception of influenza. So, and patients are also not keen to test, especially with COVID. People are tired of it. They do not want to be tested. Doctors are tired of it. They do not want to test. So on the ground, very little testing is going on across India, excuse me, and also across many parts of the world. Now, there are some other countries where testing is a little bit more frequent, where tests are freely available. For instance, free tests are available for their citizens. So in such countries, more data is available. So I'm trying to give you the big picture here. So from India's perspective, this respiratory infections were predominantly influenza related, and COVID was a minor player, almost to the point of not existing in August, September, and early October, to the tune of 1%. It's really, really small. 1% was very small. But in November, we saw that COVID was reclaiming its place as a player that contributes to respiratory infections in India. So that in our index hospitals, we found up to 9% were testing positive for COVID. I'm talking about 9% of people with respiratory infections or fever compatible with COVID. We are not talking about standing in a shopping mall and testing people. No, we're not. We're talking about actual clinically directed testing.
Okay.
So in November, it was around 8.89%. December, it is 30%, 30.
Okay.
So there we go. That's the first 3 weeks of December. I'm giving you data as of.
Okay.
But unlike the Delta wave, when many people got ill and unfortunately millions of people died, this particular variant, related to Omicron, it is largely asymptomatic. That's without symptoms, or people who have influenza-like symptoms, pretty much like body ache, severe pain, tiredness, unable to go to work for a few days, get rest at home with some sore throat, that sort of thing. Now, the people who are being hospitalized, since you asked the situation here, the people who are being hospitalized with this condition are generally older individuals and those who have associated disease conditions that destabilize when this virus lands on them. So in other words, those people are happily chugging along with medications at home, and then suddenly this thing comes, and then the balance is upset, so they end up in the hospital. They may spend a few days there, but they're all being discharged in good condition with their COVID cleared and infection and other conditions also well controlled. There are rare exceptions, very, very rare exceptions when people succumb. So in other words, the situation we are seeing are a lot of cases, but not that many are showing up in the hospital. But I'll throw a couple of words of caution there. Right now, COVID is spreading among the healthy, the most socially active, the people who travel, people who go to social gatherings and so on, parties and that sort of thing. Now, in the next phase, we do not know what the impact will be when this virus spreads to the less healthy parts of our population. Okay. Now, we'll just hope that it will not spread to a great extent, because that segment might not respond like the healthy segment of the population. So in other words, when we look at...
This is despite the vaccinations they have taken, pre-infections, all that. Despite that, you're saying that people with comorbidities, people with health-related issues might have difficulty.
Yes, indeed, they could. They could have difficulty, but not to the extent that we saw with Delta. That's in 2021. Okay. So coming to this variant, I'm sure most people have heard about it. It is an all-new variant. It is not something that I would dismiss outright. It is something that's very different from what was prevailing before. Generally, when we see the prevailing variants one after the other, they tend to have minor changes compared to the previous ones. A couple of mutations here, a couple of mutations there. But this particular one, belonging to the BA.2.86 JN.1 lineage, is so different from all Omicrons that existed before. It is classified as Omicron, but it's a very different Omicron. So which is why it attracted a lot of attention from scientists across the planet since July onwards.
Yes. So I think we have answered the first question, which was on people's mind, who had sent to me is it going to be as severe as it was during Delta? I think that we have already answered. The next question, obviously, being we are in December and in the month of December, and it is the time when people go on holidays, and with several of them waiting for New Year celebrations, Christmas celebrations. So now with travel plans on mind, the specific question I've got is, we are traveling to Kerala, we're traveling to Goa, we're traveling to Maharashtra, Dubai, Singapore, Malaysia. So should we be worried? And if when we are going here, what are the precautions we should follow?
Okay. Firstly, travel bans do not work. It never worked. All right. So that was something that was like one of the mistakes that occurred in handling of the pandemic. And we know all about that.
Yes.
People travel between countries, between states, between cities, between houses. People gather in social gatherings. It's a happy time of the year. Christmas is coming up very soon. It's next week, and we've got New Year coming up. Big celebrations are planned, so we can expect this variant to spread. It's going to spread. There's no doubt about that, and we can't stop it from spreading. But the least we could do is a couple of things. One, if there is somebody vulnerable in the family or in our social network, let's be aware that those who are healthier must be a little extra careful not to spread it to these people, not to pick up the virus, not to pass the virus on to such people. That's number one. Number two is watch for symptoms. If you have symptoms, go and get tested, because if it is COVID, then you'll need to undergo a little bit more proactive isolation. You need to stay away from social gatherings, take some rest at home, do not spread it to other people. So if you have a fever and a cough and you're resting at home, try not to mingle with other people. So that itself will reduce the spread of this virus. And the one specific advisory given out by the Kerala Health Services, that's a culture, at least in Kerala, where people go to hospitals for social visits. If somebody is admitted to the hospital, they go and see them, sit and chat. It sounds pretty nice, but from a science standpoint, it's a blunder. Do not go to hospitals for social visits.
Yes.
This is the era of video phones. You can just make a video call and say, look, the doctor said do not come to hospital. So if you go to hospital, you'll pick up a virus from there, or if you have a virus, you may pass it on to other people. The healthcare workers could be infected. They could pass on you pass on infection to you, or you could infect them and they could pass it on to other people who could be vulnerable and who may even die from it. So try to minimize crowds in hospitals. And these precautions need not be forever, tops for a couple of months. And after that, most waves will come down, with the caveat this one is new, JN.1. So we just have to wait for data that comes in every week, see where we are headed. and then make decisions.
Okay. So coming to your, I mean, you've made a lot of clinical observation about the symptoms of the disease, the way it's spreading now. So is it true that it is affecting the children most? I mean, there has been several messages which is circulating, and there have been several fake messages also going around, plus China's situation where they saw a lot of pneumonia cases and things like that. So there is this worry amongst parents that our children getting infected more. Is there anything of that sort?
Yeah, my daughter's in school now as we speak. She's taking exams in school as we speak. So children go to school, they get infected. So that is how it is. So my daughter wears a mask in school. So she so far has escaped infection. So very clearly they work. If the advice I'll give to parents would be the following. One, if your child is having a fever or a cough and a cold or sneezing, keep the child at home. Don't send to school. Please. I know it's inconvenient, but it is unkind to the whole class to send a sick child to school. Please do not do that, number one. Number two, at least from the local expertise, I'll tell you, local experience, I'll tell you, from local pediatricians, we keep in touch with them all the time. I'm not a pediatrician, but I keep in touch with the busiest pediatricians in the area. They tell me that they're seeing a lot of children with upper respiratory infections. They've been seeing them for months. Not a lot of COVID really, and none of these children are getting sick. So there's really no cause for overt concern about children and COVID at this time.
So that's another question which a lot of people are asking is, do we have to start this whole work from home thing? Should we, shut schools? Should we switch to online? I think it's too early, but then what is your take on that? I mean, is there a situation like that?
Yeah, schools are getting Christmas vacation anyway. So there will be a natural shutdown of schools anyway. So that will cut the amount of spread to a large extent. That's true. I don't endorse school closures, not for this sort of a surge. If something unpleasant or unexpected, unprecedented occurs, we'll talk about that then. But there's no indication at this time that JN.1 or other prevailing variants are causing anything unusual in terms of severity, whether it's more or less. It does spread to people. So if you're vaccinated, if you're past infected or both, it could easily infect you. So please do not be under the impression that, oh, I've taken my vaccines, I've taken 2 or 3 doses, I've already had COVID, so I will not get it. No, it'll walk right past your immune response. But on the other hand, these past exposures with vaccine and natural infection will protect most people from having a bad outcome. So that's a good part of it.
Right. So as far as, just a last question, and then you can wrap up with, if you have to say anything to add to this. In terms of medication, I mean, whenever somebody has been infected with COVID, it has just been, very, very definitely no antibiotics and things like that. So does that hold good even now? What is the kind of treatment we are looking at? If someone is...
I would qualify that further. Yeah, I would qualify that statement a little bit. You said definitely no antibiotics. That's not true.
Okay.
There are situations where if you pick up a virus infection, remember, it is disrupting your fortress. Your fortress is something that is your fortress holding out against not just viruses, bacteria, fungi, so many other microorganisms are getting a chance to break through and cause what is called a secondary infection.
Okay.
Bacterial secondary infections are quite common with COVID. So if you promote the narrative that antibiotics are dangerous or should not be used, that's wrong. So I'll caution people from saying that antibiotics should never be used. So that is not true. On the other hand, it is also true that for COVID, there is no need for routine antibiotics. That is true. For the regular person who has a little bit of COVID, there is no need for a routine antibiotic use at all. If it is influenza, which is quite common, as I mentioned in our talk earlier, oseltamivir is an antiviral agent which, if taken early enough, can change the outcomes.
So ideally, if somebody is, having symptoms of COVID-19, then I think they should ideally visit a healthcare provider to know further what they should be doing. I think that should be the best.
That's the right thing to do. That's the right thing to do. Most important is to isolate. Most important is get an assessment on the severity of the individual case. Don't assume that you will not fall sick. You must also have a plan B. When you're isolating, you should have a plan B in the sense, if things don't go as planned, what do I do next? So I think, with all the technology we have, we can be in touch with the healthcare provider and who can advise us accordingly. So far, so good.
Right. So if you could wrap it up for us, I think one last question on what else do you think we should be doing?
Yeah, we should get data. We should continue to obtain objective data. As I mentioned at the beginning, there's no point in giving opinions without looking at facts on the ground. We must look at how many cases are detected, what is the pattern of the diseases, tally them according to the frequency, old-fashioned detective work. And that is important across the world because this virus has no boundaries. We do not know which way it's going to go next year. So we have to keep an open mind, not dismiss anything completely. The second thing is, the symptoms may be similar to the common cold, but COVID-19 is not the common cold because for one simple reason. Common cold, no matter how many number of times you get it, you will not fall ill or it will not threaten your life. COVID does not work like that. It can involve the inner lining of our blood vessels. I know it sounds scary. It's true. It's called endothelium. This is a disease of the blood vessels. We do not want a virus that repeatedly affects the quality and functioning of our blood vessels potentially. So the best option is to stay away from COVID. Common cold, I wouldn't be worried about. So COVID-19 is not the common cold. I know there's a lot of minimizing happening, which is fine. I can understand different perspectives, but the fact is, it is not the common cold. So I think people should understand that very well.
Okay. Thank you very much, sir. It was really wonderful talking to you. It's always a pleasure speaking to you. Thanks a lot.
Thanks for taking up the topic.